everyone. Today I have the pleasure of introducing Amy Swales as a Mississippi Champs Hospital consultant and a registered nurse with a national certification in obstetrics. She has 18 years of experience in maternal and child health and currently works as a labor and delivery registered nurse. Today, Ms. Swales will be presenting Breastfeeding as Human Medicine, a new continuing education opportunity, which focuses on a new interprofessional education and continuing education module titled Breastfeeding Human Medicine. So if this is the clinical track of your concurrent session, so hopefully you're in the right place. If you're not, you can always click into the agenda icon on the left side of the screen, and then you can choose from the agenda all of the different concurrent sections that you want to join. There's going to be a few minutes at the end of this session for questions, and you can enter your questions during Amy's presentation in the chat box. And now, without further ado, I'm going to hand things over to Amy.
Thanks, Laura. I am perfect. Can you hear me okay? Laura, can you hear me? Okay. Good afternoon, everyone. Thanks for joining this session. I'm going to share with you today about a new interprofessional education module titled Breastfeeding Human Medicine. This presentation will give you a deeper glimpse into what this module includes. So why the need for an interprofessional education module? So to answer that, I think we need to look back at a little bit of the progress, or a lot of the progress that has happened in Mississippi in recent years around breastfeeding. And I know you heard about some of these things earlier in the opening session. Just to highlight a few things, since 2014, Mississippi has gone from 0 baby-friendly designated hospitals to currently 21 and counting designated hospitals. Mississippi is ranked 4th in the United States for the percentage of births occurring at a designated baby-friendly hospital. And breastfeeding initiation rates have increased from 57.5% in 2014 to 70% in 2017, with the most recent data released from the CDC in August of 2020. So then the question was asked, how can we build upon this progress and this momentum that we have going? And what can we do to sustain these practices and reach further? So that birthed the idea of the interprofessional education module. So we can use this in a way to reach younger generations in their academic courses of study at college, and provide them with this knowledge on breastfeeding that they may not get otherwise. And then from there, it expanded into being credentialed as a continuing education module for different healthcare professionals. So this really reaches beyond the OB/GYN specialty to different disciplines that all encounter mothers and women who may potentially be breastfeeding, and they can use this knowledge in their plan of care for her. So I want to share with you next a video that provides a little bit more of the why for the IPE.
In the past 5 years, there's been incredible growth and momentum in terms of the energy around improving breastfeeding in our state. Along with the Mississippi State Department of Health, we have been working with numerous partners, CHAMPS, the Kellogg Foundation, Reaching Our Sisters Everywhere, the Bauer Foundation, Blue Cross and Blue Shield in Mississippi, and other insurance partners. And we're all working together to ensure that our policies, our programs are all aligned with the same goal and mission of increasing the support to families for breastfeeding and seeing those rates change in our state.
I've lived in Mississippi for 38 years now and have worked in various capacities in the state on breastfeeding initiatives. And it's been very frustrating for me through the years because we have lagged behind the rest of the country. We've had the worst breastfeeding rates in the country for decades now. A lot of that, I think, is due to the socioeconomic challenges we face in our state And those challenges are often linked to low breastfeeding rates. I think what's happened in this state has been nothing short of miraculous, honestly.
Blue Cross Blue Shield Mississippi understands that there are long-term health benefits associated with breastfeeding. And so in order to give babies a healthy start, breastfeeding support and education must be a part of practices and protocols in our delivering network hospitals. And the Baby Friendly Hospital Initiative is evidence-based care that ensures hospitals that receive and retain that designation are implementing best practices related to optimal infant feeding and mother-baby bonding.
We've taken an approach to get breastfeeding support from behind the clinic walls and just going out into the community and developing some partnerships and collaborations. We're also partnering with our Mississippi Breastfeeding Coalition, also our Mother's Milk Bank of Mississippi, so that moms who may not have the means to breastfeed can provide donor milk to their babies.
It's important for Mississippi to have our own milk bank because Mississippi has too high of a prematurity rate not to. Human donor milk is what saves the lives of these really premature babies that Mississippi has 17% of. Higher than that among minority populations. It's up to 20% among minority populations. We don't want to replace the mom's own milk, and certainly the moms need to be getting pumping and getting whatever to get their own milk supply up. But when you give birth at 25 weeks, your body was not expecting to need to make milk quite yet. And so there's a gap there. And so the donor milk fills that gap. Donor human milk is prescribed for the same reasons and often for some of the same problems as donor blood would be prescribed, the most critical circumstances. Okay, so it's the tiniest and the sickest babies. It's prescribed because it's standard of care. There are 11 NICUs in Mississippi that are prescribing human donor milk.
One of the major things that we feel has changed, of course, is policy. As a nurse, we know that nurses don't do things if there is not a policy for it. If there were no infant feeding policies, then all types of things were being done. The mothers would tell us if they ask 5 people the same question in the healthcare setting, that they get 5 different answers.
I've trained about 2,000 or so nurses in just about every hospital in the state. And I'm really seeing a groundswell of optimism and support. Nurses are excited about sharing about breastfeeding with patients. The Baby Friendly Initiative gives hospitals the how. It's not enough to say, we support breastfeeding if you don't know what that looks like. And the Baby Friendly Initiative gives hospitals the how. It teaches them, these are the clear steps you need to take in order to make that happen. And that's what hospitals have been waiting for.
I think it's important just to remember and to realize that it's going to take us all. And if we really come together in this work, that we will work to create a healthier, not only a healthier Mississippi, but a healthier nation in general by strengthening our families one baby and mom at a time.
So the main contributors to the IPE are Doctors Elizabeth Franklin, Dr. Ann Mearwood, and Dr. Lori Feldman-Winter. There was also a committee that included subject matter experts from each of the various schools of health-related professions at the University of Mississippi Medical Center. They were there to ensure the content was relative and accurate to their discipline. This is an online interactive education module. It includes video scenarios with an OBGYN, pediatrician, pharmacist, nurse practitioner, social worker, dental assistant, and lactation consultant. There are 30 multiple choice questions divided up over 4 cases. In the end, the learner is provided a certificate of completion for students or a continuing education certificate for healthcare professionals. These are the 6 learning objectives for the modules. Describe the national goals and recommendations for breastfeeding in the U.S. Describe the evidence base behind the benefits of breastfeeding. Recognize how a team-based approach impacts breastfeeding success. Identify best practices in promoting optimal maternal child health outcomes. Identify socio-demographic factors that underlie current breastfeeding trends. And describe the scope of different healthcare professionals as they relate to breastfeeding support, promotion, and success. This is the home screen on the online, on the module once you log in. The module is divided into 5 cases, which follows the natural progression of a mother and infant from pregnancy through her birth experience, pediatric checkups, and return to work in the community setting. One case addresses the bigger picture in the US and the public health implications of breastfeeding. If you look in the upper right-hand corner, you will see the link for the instructor's guide. This provides the professors in colleges and universities a breakdown of each case objectives along with group discussion talking points. Once you open each case, you will see the subtopics that are covered. Each case starts off with a pretest to assess the learner's base knowledge. The V next to the topics are for videos, and the P are for PowerPoint, which are short and include a voiceover. A multiple choice post-test is then completed at the end of each section. Case 1 here is covering prenatal visits with the mother and includes information about breastfeeding and medication, breastfeeding counseling, skin-to-skin care, and contraindications to breastfeeding. Each case has several video scenarios which feature some of our very own here in Mississippi. I picked a video or a clip from each of the cases to really give you a better idea of what this module looks like and feels like. So this next video from case 1 is a pregnant mother at a prenatal visit with her provider.
Hi, Miss Adams. Thanks so much for coming to your prenatal visit today. You have been doing fantastic for your first pregnancy. Your type 2 diabetes is well controlled. Your blood glucoses look phenomenal, and that's not always an easy task, so pat yourself on the back for that one. Your weight is exactly where we would expect it to be at this point in your pregnancy, and your blood pressures are well controlled. So you're doing a great job. Now, we will have to keep an eye on your blood sugars and your blood pressures as we progress through your pregnancy, just to make sure that they don't become more problematic toward the end.
Okay.
Do you have any other questions for me?
I think I'm good.
Now, you know we can talk about anything. It is your first pregnancy after all. No questions at all?
No?
Well, you know, the last time you were here, we did mention breastfeeding. Have you had a chance to think about that anymore?
Not really, no. I mean, is it really the best thing for the baby?
Well, absolutely. We strongly encourage our moms to breastfeed. There's so many great health benefits, both for moms and babies.
And how long would I have to do that for?
Ultimately, that would be up to you, but the recommendations are that you would exclusively breastfeed for 6 months and then continue on up to a year, maybe even more if that's what you're comfortable with.
But I really don't think I'm going to be able to do that because I'm diabetic, so.
So tell me a little bit more about that.
Will I make good enough milk to do that? And plus, I take all these medications, so I honestly just feel like there's way too many problems for someone like me to be able to breastfeed.
So I'm really glad that you brought that up. We especially encourage our diabetic moms to breastfeed.
Really? Why is that?
Well, because you have high blood pressure as well as diabetes, breastfeeding can actually help to keep you healthy, as well as decrease the risk of complications developing for your baby. So can you believe that moms who breastfeed can actually get better glucose control? And it's even been shown to help decrease the occurrence of diabetes in their babies. Also, breastfeeding can help decrease your overall risk for heart disease, so it can help keep you healthier for your baby. Plus, it's just a really nice thing for you to do, and I'd hate for you to miss out on that because of your condition. I mean, by the way, you're going to make perfectly good milk.
Wow, I didn't know that. I would like to know a little bit more about breastfeeding.
Well, that's great. You know, our office offers classes for breastfeeding, and the WIC office will also offer you classes both before and after the baby's born. So we'll make sure to get that information to you before you go.
That would be great. Thank you.
This is a sample slide of the short presentation that covers medications passage into breast milk from this case. Case 2 covers the birth experience for the mother-infant dyad and includes the in-hospital pediatrician visit, the lactation visit, and the 48-hour discharge follow-up appointment. The next video is a clip of the pediatrician visit during the hospital stay.
Your baby's doing very well, Mrs. Brown. Everything looks fine, and it's excellent that you're breastfeeding. Now, what questions do you have for me?
Well, the skin to skin right after he was born and having him in the room with me since have been so nice and have really helped me with breastfeeding. I really wanted to breastfeed, so it's great having all this support right here in the hospital.
But are you sure he's getting enough, doctor? The nurse told us this morning that he lost weight.
It's great that you mentioned that, Mrs. Logan. You're right. It's natural for babies to lose weight the first few days after birth. In fact, we expect them to. Now, we will weigh your baby every day that they are in the hospital. It's not unusual for them to lose anywhere between 6 and 10% of their birth weight. So by day 3 or so, your milk production will go up. Your baby's weight is one of the things the pediatrician will watch very closely when the baby goes in for his visit 2 days after going home.
And how do I know if I am making enough milk? This is my first baby. I really don't know how to figure that out.
She had lots of bottles when she was a baby, you know? I never made enough milk.
Well, these are all very, very good questions and concerns. Now, all mothers don't make a lot of milk at first. The milk that you're making may be small in amount, but it's perfect for your baby because your baby's tummy is so tiny. We call this milk liquid gold, and it's perfect for your baby. In a few days, your breast will start to feel fuller because your milk production will start to go up, and you should start feeling more comfortable about your milk supply then. Meanwhile, rest assured, we will be watching and weighing your baby here in the hospital. If there's anything of concern, we will make sure that we inform you.
So you're sure he doesn't need a bottle?
Right now, he's doing very well breastfeeding. As long as he is regaining weight by the 5th day or so, and you feel comfortable with breastfeeding, we recommend nothing else but breastfeeding.
Included in this case is also a lecture on the components of mature human milk, including a more in-depth look at human milk oligosaccharides. This is really, it's a 2-part lecture in this case about HMOs, which is really fascinating, especially if for someone that doesn't know much about them or if you've never heard about them. I think this is a huge takeaway as a part of this. Case 3 addresses the bigger picture in the U.S. and the public health implications of breastfeeding. There is also updates giving on the breastfeeding progress here in Mississippi, along with the supporting data. This next video is some of the interviews about all the progress that has been made here in Mississippi.
I always believed in my heart that someday Mississippi would come on board, that the baby-friendly initiative would take off, that mothers would breastfeed. I think what surprised me is how fast it's happened and how quickly the momentum has built.
What I am sure about is women in Mississippi want to do what's best for their babies and their families. And if we can get them the information, they will want to breastfeed.
It's really not that mothers don't want to breastfeed in Mississippi. That's a myth. Women want to, families want to, but we really have to improve the support from within the community, at the hospital level, and through all the way through our state politics to support moms and families to achieve those breastfeeding goals.
I know how resilient and wonderful that the mothers are, and that the wave would come down. We know that things sort of start on the East Coast and the West Coast and filter down to the Southeast. However, this state, Mississippi, has gone way further than all of the other states in the Southeast at working with the hospitals and getting them on the baby-friendly pathway.
Prior to coming to Blue Cross and Blue Shield of Mississippi, I spent 17 years in the hospital setting, and it has been so exciting to see the progress that has been made related to the baby-friendly hospital designation and just breastfeeding rates overall in our state.
I did think it was going to happen in Mississippi, not on the scale or in the time that it has happened?
When I had my first baby, it was not even asked of me how I was going to feed my baby. It was just bottle checked on the chart.
I personally breastfed both of my children, and it was such a rewarding experience.
I participated in a medical mission to Africa. And although the medical mission had nothing to do with delivering babies, one of the things that I noticed was that women would come from miles around seeking medical care, and they didn't have daycare or anybody to leave their children. They brought their children with them. And so there were all of these women who came and sought care from us who had their babies, just carrying them neatly wrapped on their back. And whenever their babies were hungry, they didn't sit down and open up a lunchbox. They didn't go down the street to a local store. They breastfed their babies. And originally, I was a little shocked. I thought in the United States that would never happen. But I saw all of these women just feeding their babies in a way that was so natural. And as one little baby's head would pop up and it would hop on its mom's breast and start to feed, and another baby would do it, and another mom would feed her child, nobody ever blinked an eye. It was normal and natural. And that was something that was very beautiful to me, and it made a lasting impression on me. And at that moment, I decided that if I ever got married and had children of my own, that I wanted to try this breastfeeding thing. And that was instantly when my whole opinion about that changed. I remember one time I asked my mom as I was feeding my children, I said, "Did you breastfeed me?" And she said, "No, that wasn't, I didn't know anything about it, and I didn't have anybody to help me do that." She said, "But seeing you with your children and how that just is solidifying your bond and how beautiful it is, it makes me wish that I had done so."
Just that whole magical thing that happens when a mother and baby get together. They fall in love with each other, and breastfeeding, becomes much easier to encourage that mother to try.
Breastfeeding is human medicine. It's as though it is a treatment that comes of our own bodies, of our own selves. We talk about plant-based foods and natural diets and all these other things, and yet here at the very core of who we are as human beings, we have this natural medicine, sustenance that comes from within us. And I think it's one of the most beautiful things, besides giving birth, that our bodies are able to do.
These are some of the breastfeeding partners across the state who, along with so many of you here today, have all played a part in moving the needle when it comes to breastfeeding. I think it has been one huge collaborative team effort here in Mississippi. There's also information in this case about infant feeding during emergencies. This module is so up to date with information. It even includes recommendations during emergencies such as the COVID-19 pandemic. Case 4 covers the expected growth of an infant, sources of support for the mother, and planning to return to work while breastfeeding. There are a couple of short video scenarios in this case that show a stressed mother at her baby's checkup and the counseling she receives. I'm going to share with you next a video from one of those counseling sessions.
I heard you say that you're also concerned with having a space in your workplace to pump. Is that right?
Yes.
Okay. Well, you should know that legally, your workplace is required to have a space provided for you that is not a bathroom.
Really?
Absolutely. The United States Breastfeeding Committee website is a wonderful resource. They explain what the law says in terms of space and pay and all the other considerations like how long your breaks should be. They also provide wonderful information about storing and handling expressed breast milk. I'll make sure to give you the link before we leave.
Wow. That's great information to have. I don't know where to begin asking my employer, though.
I know that when you're a new mom, it is so overwhelming. There's information coming at you left and right, but you're not alone in this. So let's think about it together. I think one of the things is that you work for a gym, so they obviously have an emphasis on health and nutrition. I'm sure lots of their clients are young women who are also breastfeeding, so a space provided to you to pump would also be a space for them, and that could be beneficial for everybody.
That is a great idea. I will get on it right away, and I will talk to the daycare center about storing the pump milk.
Yes, we have a great resource for that, and here in Mississippi, child care centers are required by law to provide a refrigerator to store express breast milk. They're also required to provide a space for you to pump.
Wow, I had no idea. It's amazing how little I've ever heard about this.
And they're required to train the daycare staff in proper storage and handling.
Do you think they really do that?
I sure hope so, but at least this will help you do the research so that you know what they should know. Do you have any questions?
No, I don't think so. Not right now.
Okay, great. Well, here's the information to help guide you as you're looking into things. Call me anytime with any questions or concerns you have. And congratulations on breastfeeding your baby thus far. That's a big accomplishment, and it's really going to help guide you as you transition into the workplace.
This slide is an example of the newborn stomach that is included in this lecture about the growth of an infant. Growth charts for term and preterm infants are included along with how to read these charts. Case 5 is a video of a community support group where moms are discussing their experiences. This video includes flashback clips of each of their varying experiences and how it impacted them. This case does not have a pre or post test as a part of it. This is a longer video, so I'm going to share with you just a clip from that one video.
Welcome, ladies, to this part of our support group where we just talk and we support each other and get some encouraging ideas. And I see some new faces today, so why don't we just introduce ourselves and just tell us a little bit about your breastfeeding experiences so far.
Hi, well, I guess I'll go first. I'm Dana Brown, and breastfeeding is going really well at the moment. And I'm so relieved because I really wanted to breastfeed him, and I wasn't sure if I could do it. My family wasn't terribly supportive, but it's going really well now. We're enjoying it.
Hi, my name is Jamie, and this is Charlotte. And I am back at work now. I had kind of a freak out period when I was going back, but I think I kind of got that under control. Actually, my workplace is really interested in getting a breastfeeding program going for the gym and the employees, and I didn't think it would work out that way. Anyways, the people at the pediatric practice suggested that I'd come to one of these support groups to meet other moms, and so here I am. And I'm like a local expert in breastfeeding and workplace law, so if anybody has any questions, I'd be happy to help.
Hi, I'm Maria, and this is Dominique. She's my second. I'm sorry to say that breastfeeding has been a real struggle for us. There's just so many things went wrong.
I'm so sorry to hear that. I'm Trish, by the way. And I guess I'm lucky, I suppose. I have diabetes, and I wasn't sure that I'd be able to breastfeed, but with support, I learned to manage it. And, yeah.
I'm Sonia, and this is Ellie, and I've been here quite a bit. We just like to chat with other breastfeeding mothers. Ellie's my third, but I still really like to come to connect with other mothers.
That's great. Thank you all for being here. This is a great group. Maria, I heard you say that you'd had some struggles with the breastfeeding. Is there something you'd like to share with us about your experience?
This is an example of one of the 30 multiple choice questions that is divided up between the 4 cases. If you miss a question, it does tell you where to refer back into the case for the correct answer, and a second try is provided if needed. You do need to score an overall 70% to get credit for passing the course. So who should complete the IPE module? Well, honestly, everyone, ideally. This education module is currently available to all Mississippi colleges and universities for free, thanks to funding from the Bauer Foundation. This is packaged up curriculum that is ready to be implemented into coursework. Some of the suggested courses that it supports nicely are health-related courses, nursing programs, and public health paths of study. All licensed healthcare professionals are encouraged to complete the course for continuing education credits. If you are a healthcare professional in Mississippi, it is available to you for free. I'll repeat, free continuing education credits. This course is available for anyone to complete outside of Mississippi for a small fee. These are a couple of the discipline-specific continuing education credits that are provided. This is the flyer for the IPE that is available for you to download on the conference platform. If you look under the sponsors tab, you will click on the Bauer Foundation, and then from there, click on Aspire Health, and you will find this flyer that you can download to save for later if you want a reminder. So if you see on the right-hand side, those are some of the continuing education credits that are offered. These are some pretty elite credits, as you can see. The physicians get 3.5 AMA credits, NAP for pediatric nurse practitioners, LSERPs for IBCLCs or CLCs, nursing credits, social workers. You can read through it all here, but once again, if you're in Mississippi, this is available to you for free. The module can be accessed if you look on the left-hand side of the flyer at the bottom at inspirehealth.org. There is a dash or a hyphen in between Inspire Health. This is the Inspire Health website. So this is what it looks like when you visit the website, and you will want to click on the Breastfeeding Human Medicine course from here. And then you will get a pop-up that looks like this. So you will either choose the college course if you're a student learner, or a healthcare professional, you will want to click on the CE course. The courses are exactly the same. They both look like the home screen of the module I showed you in the beginning. The content's the same and the test is the same. The credit that you get for the course is just different depending on which one you choose. So for the college course, you'll want to register using your Mississippi college or university email address. That's what will give you access. And then you will get an email back with the link to create an account. And then for the CE course, it will also take you to the platform where that course lives, and you will create an account. And then for both courses, you have an account created. You can log in and out as many times as you want. So you do not have to complete the course in one sitting. You can complete it in multiple sessions if desired. So to recap, you can visit the module now at www.inspire-health.org. If you're in Mississippi, it is available to you free. If you're outside of Mississippi, it is still available to you just for a fee. If you have any questions about the module or would like more of a one-on-one discussion about it, please contact me at Amy Swales at inspire-health.org. If you're a part of a group, committee, or coalition that may be interested in sharing this information, please send me an email and I can share with you some templates that will make that sharing a little bit easier. So thank you so much for joining this afternoon, and I hope you will consider completing the module and sharing it with others.
Thank you so much, Amy. That was great. There was a lot of chatter in the chat box. I think people really responded to those videos really well, and they rang true for a lot of different people. So now we have 5 minutes for questions from the audience. And the question that I saw so far was about accessing the training, but I think you've answered that since then. And let's see. So we have one question that says, are students outside of Mississippi able to take the course? So students, I guess, or do you have to be a licensed provider?
So it's you can still take the course as a student outside of Mississippi. You could just take it as a CE course, as just a general CE credit, but it would be a fee related to it. If there is overwhelming interest in a college or university outside of Mississippi using it in their course study, just please send me an email and we can further discuss that.
Awesome. We have another person who posted, this might be more of a comment too. You might have some thoughts about this, Amy. To help promote breastfeeding with the community, would it be possible to create PSAs for TV and social media to normalize and promote breastfeeding? Some of these video clips would be great in a PSA for Mississippi. Is that something that you all have heard about or thought about at all?
No, it's not. I mean, it's not something I've heard, mentioned from these videos, but I do think PSAs are a great idea, and PSAs on breastfeeding to normalize it is a great thing. So that's a great thought. I have not thought about that, but that is a great idea that we can discuss further for sure.
The next question is, do you have contracts with any state DPH programs?
No.
And that's something, but that might be something if someone's interested in their state program, kind of starting a contract with you all, they could contact you, Amy?
Yeah, absolutely. It's great networking.
Yeah. Okay, then I think we'll wait. So there is a little bit of a delay sometimes for some of these questions coming through. I think we've answered everything so far. We do hear, I see a lot of, like, fantastic course, thanks for sharing, those kind of comments. But we have until 3:20, so we'll hang out here for a minute, see if any, okay, here we go. Do you share with other states? I work as a public health nurse for Maine.
She can certainly, this has not been shared, outside of Mississippi as far as student learners, but for healthcare professionals, it is available worldwide. So if she'd like to, she can send me an email and we can, discuss it further, but it is available in Maine and all of the United States.
Great. And you feel like, I'll do a follow-up question for her too. Do you feel like the content, I know you kind of have Mississippi-based clinicians, and some things talk about Mississippi law, but do you feel like for people outside of Mississippi, it's still really applicable, the training?
Absolutely. And I know, we comment and say this so much, if Mississippi can do it, anywhere can do it. And I can say that as a true Mississippian, but, we started from the bottom, honestly, with breastfeeding, and look at the progress we've made. So I think this would apply for any state in our country could use this content and look at us as an example of where we started and how far we've come in just a few short years.
Great. We do have another question. How long does the course take to complete?
It's 3.5 hours. So it provides 3.5 hour credit. So it takes right around there to complete the course. That's a great question.
Nice. And I'm going to be entering your email address because some people were asking for that. But it is Amy Swales at inspire-health. .org.
Yeah.
So I'm going to enter that into the chat. You all can find that. All right. Well, any other questions at this time? All right, well, if more questions were, oh, here we go. Okay. Well, we just have a comment. Public health nursing in Maine works mostly with prenatal and postpartum women, and I have my CLC. And I think the same kind of goes, for, we have with Mississippi WIC, they are working, we have some prenatal breastfeeding and postpartum breastfeeding and some CLCs, but hopefully this course would be of interest to, I know this course would be of interest to other people in the state, other states. Amy and I are going to hang out here. I know some questions are still trickling in, so we'll stay here for the next 5 minutes. We can answer any questions, but if otherwise, I just wanted to let you know that if you will get 5 minutes at the end of the session, 3:20 Eastern. You'll have 5 minutes to get to your next session. So if you are planning on attending the next clinical track session on Blue Cross and Blue Shield of Mississippi's maternity quality model, you can just stay right here where you are. Otherwise, you'd want to click back into the conference agenda link on the left side of your screen, and then you can select a different session. But Amy and I will hang out here for the next 4 minutes in case you all have any other questions. Otherwise, thank you very much for attending this session.
Some good sessions today, that's for sure.
Yeah, I really enjoyed the day. If there's anything, I guess, Amy, I have a question. Is there any kind of message or anything that you would want to say, like as a nurse working in Mississippi and kind of experiencing it from both sides? So you've been involved with the creation of the IPE, but you're also a bedside nurse.
Yeah, for me, I would say the most exciting part of this is we've done so much work in Mississippi inside the hospital walls and we've made such huge progress, but I feel like reaching outside the hospital has been the challenge. We have our, community groups that we've been able to reach, but then outside of there, it's been just kind of a wall up. And I really feel like this IPE is a way to reach those places that we haven't been able to reach before. I think starting with the younger generations, with the students in college, that this is a great way to provide them with knowledge for years to come that's going to impact them. Kind of like, Dr. Michelle Owens and her mission trip, when she was in medical school, and that totally changed her outlook from then on breastfeeding. And I'm really hoping this course can do that for a lot of these young learners. And then from the other side, reaching healthcare professionals that have been in practice for 30 years and maybe never even got really education on breastfeeding because they don't really teach it in medical school. So for me, it's really exciting to use this IPE as a way to reach deeper than we've been able to reach before in our state.
It is pretty unique that it can reach both those, students, people who are going to be new to the field, and even it's the potential of reaching those, the providers, the nurses, the doctors that have been doing this for 20-something years, and has a possibility of changing both of those, both of their kind of lives and their different practice. It's pretty cool. Excellent. Well, I'll check the questions one more time. Okay. This will be our last question. Do you think, Amy, that it could be used in a high school health class, or would it be too advanced?
I don't think it would be too advanced. The questions, she may want to take it herself and take it, but the questions are not that in depth, I would say, or not that hard. And the content's covered pretty easily to cover those questions. So I think it would be great to use in a high school course, especially a lot of high schools here have health science academies, that it would fit perfect in that curriculum. So absolutely.
Great. Well, I think that'll wrap everything up. Thank you again, everybody who was attending, and thank you again to Amy for presenting. It was great.
Thank you.